Welcome to Understanding How to Navigate the Health System, a Guide for Citizens. This is the second module focused on care for select conditions. My name is Christina Madison, and I'm a scientific lead at the McMaster Health Forum, and I'll be walking you through this module. Certain conditions may be cared for differently in the health system based on past decisions made by policymakers about how care is organized for the condition, their financial implications, for example, cost to care or international funding priorities, or their relative importance, which can include things like if the condition is common or not, the impact of a condition as measured by financial cost, mortality, morbidity, or other factors. 4 conditions that are treated differently than the rest within Ontario are mental health or substance abuse, work-related injuries, cancer, and end-of-life care.
Mental health and addictions care is often distinct in the settings where care is provided and in the professionals who provide that care, and more generally in how care is largely siloed from the delivery of, quote, physical care. Care for those with work-related injuries and diseases is unique in how it's overseen by the Ministry of Labour rather than by the Ministry of Health and Long-Term Care. Cancer care, on the other hand, takes place in an almost entirely parallel subsystem, with one agency, Cancer Care Ontario, having been delegated responsibility for the planning, funding, and delivery of cancer-related services. Finally, end-of-life care is distinctive in the way that it cuts across most of the sectors.
Care for people with mental health or substance use problems is delivered through many different programs and services, from information and advice to specialized inpatient programs for those with severe and persistent mental health or addiction concerns. In many types of places, for example, community mental health and addictions organizations and hospitals specializing in mental health and addictions, and by many types of health professionals, for example, psychologists and social workers. Care for people with work-related injuries and diseases is delivered often in familiar places, for example, physician offices and hospital clinics, and is financed by employers, directly or through premiums, with eligibility for funding determined by the Workplace Safety and Insurance Board, or WSIB. Cancer care, from diagnosis to treatment and follow-up, is delivered primarily in hospital-linked regional cancer centers and by many types of health professionals who specialize in cancer. End-of-life care is delivered in a wide variety of places, for example, home, hospices, hospitals, and long-term care homes, and through regional palliative care networks, which are starting to bring more consistency to what patients, families, and their caregivers can expect with such care.
Part of what is unique about the 4 conditions is care for these conditions may introduce a patient to people and places that are very different from the ones they interact with. Mental health and addictions care, for example, may be obtained through community mental health centers or, for severe and persistent problems, in mental health and addiction-specific hospitals. Care for work-related injuries and diseases can often be obtained through family physicians and specialists as usual, but sometimes the relevant specialty care is provided by dedicated clinics. Either way, this type of care is paid for by the Workplace Safety and Insurance Board, which is responsible for determining the level of work-relatedness of the injury and deciding what would be paid for. Sometimes what is paid for includes additional rehabilitation care, assistive devices, or prescription drugs that would otherwise require out-of-pocket payments or private insurance. Cancer care is accessed primarily through regional hospital-affiliated cancer centers, of which there's one in each of the province's 14 regions. These centers are where patients typically go for the tests that determine the type and aggressiveness of a cancer, for chemotherapy and other forms of cancer treatment, and for the regular follow-up afterwards. Palliative care can take many forms, depending on many factors, including geographic location. The care can be provided in many settings, such as a patient's home, a hospice, or a palliative care unit in a hospital, and it can involve many different health professionals, ranging from a home care nurse to a family physician to a specialist palliative care team that works with the home care nurse, family physician, and others.
Some conditions are addressed differently within the Ontario health system. Mental health, work-related injuries, cancer care, and end-of-life care are examples of such conditions. They differ from other conditions in regards to who provides the care, where care is delivered, and who makes decisions. This is the end of Module 2. Up next, we will review how the Ontario health system delivers care for different treatments.